Good morning, everyone. Hi. For those of you who don't know me, I'm Elliot Menschik. I run the healthcare side of DreamIt Ventures, and I want to welcome you all here today to Demo Day for DreamIt Health Philadelphia 2014. For those of you who are inclined to tweet, there are many people who could not be here today, so I want to encourage you to use this hashtag tweet. It's really a great way for those who are somewhere else to follow along, get your insights, your immediate impressions of what you see here today. We're going to be hearing from 10 different companies. 4 of these companies are born and bred here in Philadelphia. The others were recruited to come here from a variety of cities around the country. And these 10 companies are the third cohort of DreamIt Health that we have run thus far since starting last summer. They joined 20 other companies, 10 of which went through DreamIt Health Philadelphia last summer. Many of you were probably here for our first DreamIt Health Demo Day last summer. And then the second group of 10 were part of the DreamIt Health Baltimore program. And I'm pleased to announce that we have a 4th cohort kicking off in late January, again in Baltimore, again partnered with Hopkins, University of Maryland, and a whole variety of other organizations down there. So that's just my shameless plug for applications. Please send them our way. We love to find amazing teams and companies, as you'll see. Now, the sandbox that these companies play in, if you will, our industry, healthcare, is a gargantuan one. It's just insanely vast, $3 trillion industry, and just, it's such a mind-bogglingly large number that to just put that in perspective, that is 300 times the size of the Hollywood movie industry, okay, 300 times. So this is a huge industry with many inefficiencies, as we all know, many opportunities for reinventing how things are done. And we hope at the center of all of this is the patient themselves. At least that's the concept and certainly the goal towards which we are moving. But there are a whole variety of complex other stakeholders out there who all have a vested interest in what happens in this industry. There are obviously the providers who are delivering the care. There are payers who don't just foot the bill, but make sure that the quality of care and the quality of the network and all the other processes in place to make sure we have the best care delivery systems and healthcare system as possible. There's obviously vendors as well who are bringing new innovations around diagnostics and therapeutics and devices of all sorts to drive the industry. And government plays an important role as well, not just as a regulator, but as a public health entity and actually as the biggest payer of all. Now, when I was in medical school, one of my professors, Bill Kissick, he was one of the architects of Medicare in the Kennedy administration. It was one of the few business classes we actually had in med school, and he was sort of sharing what he saw as the chief obstacle to many innovations making it into the marketplace as startups and beyond. And it's what he called the iron triangle of healthcare, which is sort of this historical model where the patients get the benefit but don't pay, and they don't make the decisions, while providers make the decisions but don't pay and don't get direct benefit. Of course, payers foot the bill, but typically would not be making decisions or benefiting directly from those decisions. And now today we live in a world where these lines are beginning to blur. In post-Affordable Care Act, certainly the consumerization of healthcare means more and more patients are taking responsibility and making some of those decisions and footing the bill. More and more the line between payers and providers is blurring as risk shifts. And it's really at the intersection of and the borders between these organizations and responsibilities where all these new opportunities arise for startups to make a difference. And so it shouldn't be any surprise that the companies you're going to hear from today really all live at those interfaces where there's new opportunity to introduce new products and services that change the way business is done. Now, none of this would be possible were it not for the incredible commitment and deep support and engagement of 2 extraordinary organizations here in Philadelphia, Penn Medicine and Independence Blue Cross. And so without further ado, I want to introduce to you the CEOs of those 2 organizations, Dan Hilferty from Independence Blue Cross and Ralph Muller from Penn Medicine, to share their perspective on Penn's efforts, on Blue Cross's efforts with DreamIt, and where we go from here. So please.
Thank you, Elliot, and good morning, everyone. On behalf of the 8,000 plus associates of Independence Blue Cross in 25 states and the District of Columbia, I'd like to thank you, applaud you for this great effort and what it means to healthcare in the future. I'd like to take a step back for a second. Here I am sharing the stage with Elliot. Has anybody read Elliot's bio? Physician, engineer, hacker. Guy's a hacker, ex-hacker. And he's a serial entrepreneur. Well, isn't that really cool? And he works with a company, runs a company, DreamIt Health, that is not only making your dreams as entrepreneurs come true, but changing the face of healthcare, changing the way healthcare is delivered to every citizen in this country and beyond, and doing it in a way that is more efficient and moves us towards a higher quality product. Then there's Ralph Muller. Ralph is the president and CEO of the greatest health system in this country. I mean, it's rated by magazines, and by the way, we have other great ones here too, so I don't want to in any way diss them. But Ralph, we're partners in this, so I'm going to say that. You know, Ralph is, he has a history in public policy, Harvard educated in that regard, and here's a guy that really knows how to take a very complex organization like Penn Health System, get docs and administrators and other clinicians, nurses working, pulling this great organization in the same direction for the benefit of the customers, the patients that they serve. And so the products, the ideas, the technology, the different types of services that you dream up, that you bring from a thought to an incubator to a business, are helping Ralph and the great team of clinicians that make up the Penn Health System to solve very complex issues. Well, then there's me. I come from the big, bad health insurance business. But there's good news. There's a company called Public Opinion Strategies that just did a survey. We now rank higher than Congress in public opinion. So that's really a good thing. But the truth of the matter is, it's companies like Independence Blue Cross, where these colleagues that I have the privilege of working with every day are coming to work with new and better ideas. Because we believe it's our mission, it's our goal to change healthcare. It's our responsibility to change healthcare, change the way it's delivered. And I couldn't agree more with what Elliot said. It starts with the patient at the center, our member. And the rest of us are cogs in the circle. And our job is to find ways to go across borders from payer to provider, from payer to innovator, from payer to new startup companies, new startup technologies, new startup services that truly get to the point of creating a more high-quality system that drives down cost. When 18% of gross domestic product goes toward healthcare, and unchecked, it'll be 25% by the year 2025. When prior to the Affordable Care Act, 40+ million Americans were uninsured, accessing care through emergency rooms and other high-cost ways. So we needed to develop a system, and the Affordable Care Act is a start. It's not perfect, to bring people into the system. So far, 8 million plus have joined. We'll see how this next enrollment goes. As Medicaid's expanded, more and more people will be brought into a system where they'll have a patient-centered medical home, where they'll have their own clinician that they can talk to. We're using everything from the technologies that you're developing to other systems of support. Will be able to take hold of their own health care. Be partner with the physicians. Be partner with Penn Medicine, Penn Health System. Be partner with organizations like DreamIt Health. And yes, be partners with their insurer. Because we all have a stake in doing this. So what you're doing today, what you continue to do in developing these new businesses, yes, I hope you make a lot of money doing it. But please know that what you're doing is important to pivoting the healthcare system as a whole and ensuring that we in the United States, by the way, we do have the best healthcare in the world, and Ralph can talk chapter and verse about that. We have the best healthcare, but we need to get further ahead, and we need to make sure that nobody is left behind as we use these great technologies that you are building, as we use great systems like Penn Health and Independence Blue Cross across this country to ensure that great things happen for our customers and Ralph's patients. So thank you very much for being here. We at Independence Blue Cross stand committed through our Independence Blue Cross Center for Healthcare Innovation. We believe, and this is my closing comment, we believe, because we've traveled to all these innovation centers all over the country, starting in Silicon Valley. When you put the Philadelphia region, no offense to Baltimore, no offense to Boston, no offense to all these other places, when you look at the resources we have right here in the 5-county Philadelphia area, into New Jersey, down into Delaware, you've got the best health systems in the country. You've got insurers who are ready and willing to not only put their money on the table, but to be partners through innovation centers in developing the things that you're working to develop every day. We've got pharma. We've got the best colleges and universities in the area. We've got government that is interested. And government was a big piece of what Elliot put up on the board. This area, Philadelphia, I've said it before, I'm going to keep saying it, should be the Silicon Valley of healthcare innovation. And what you do, whether you started here, whether your bright idea started right here in the 5-county, or you came here to nurture it and get the funding that you need to make it a reality, we want to encourage you to stay right here. Stay right in this great area of Philadelphia, because something is starting here. And it starts with Penn, it's with Drexel and the other universities, it starts with Independence Blue Cross, and it starts with many, many organizations who are ready and willing to step up and give you the resources and create the environment that you need to be very successful. So we are proud at Independence Blue Cross to be part of this. And please, make sure you know that as you develop your business, not only do we want the opportunity to maybe be a minority investor, if it's a great idea, but we want to help you by giving you the data in a very HIPAA-compliant way, giving you the tools. Steve, are you all right with that? So that you can do the things you need to do to find out if your idea is for real. So thank you very much. Keep doing what you're doing, and Independence Blue Cross will be here as your partner. Elliot, thank you.
Well, you can see why we love being partners with Dan. His enthusiasm is everywhere, and we see that on a daily basis. You know, the energy inside this room is so palpable as well, so I celebrate with you all coming together. You can tell Dan and I are the generation that still wears these ties, so when we come to work with you, and looking out here, I see there's a few of us out here, not that many anymore. But, you know, both Dan and Elliot have spoken about how big and complex healthcare is, so part of my suggestion to you is as you innovate and you bring these kind of technologies to bear, remember that it's not a simple world you're entering into. And the healthcare system is a bit too complex for the patients, a little too complex for us as a health system, a little too complex for Blue Cross. And part of what you want to be thinking about as you go through the next generation is how do you make it a little simpler, but you can't make that complexity go away. When you're $3 trillion in the economy, when you're 18% of the economy and so forth, there's reasons for that kind of complexity. So part of my advice to you, not to dampen your enthusiasm, is, and I'm glad you've had a chance over these last few months to work inside Penn Medicine and other health systems. Roy Rosen, my partner, who's the Chief Innovation Officer at Penn, tells me some of you have gone out to 60, 80 other places to kind of talk to people and so forth. Keep getting a sense of what really is broken in American healthcare, because we need your help in fixing it. But it's not going to come by having one simple app. It's going to come from understanding why the rules are there, why there's such rules in insurance, as Dan says, that cause patients to sometimes not evaluate insurance companies as high, why there's kind of complexity in getting access to Penn Medicine that causes sometimes people to be unhappy with us. And obviously, in the last year or two, you've seen a lot of unhappiness with government as well in terms of how people experience it. And that reality is not going away anytime soon. So part of what we're asking you to do is help us solve some of that, but it's not going to go away magically. And I think as we've seen, some of the, this is our, we've had these rounds of DreamIt before, and trying to figure out exactly which of your companies is going to do well. I wasn't very good when I heard the first round when I was standing here a year or two ago. I wasn't very good at figuring out which ones were going to succeed, and I'll be very enthusiastic to hearing all the presentations today. But part of what you want to be thinking about as you're developing these companies is how do you make this system work for the patient, as Dan said? How do you figure out, how do you weave your way through the complexity of insurance regulations and what providers do? And we all know that increasingly, whether it's under Affordable Care Act, which is the official name of Obamacare, or what IBC is doing, or what Penn Medicine is doing. Increasingly, we want to figure out how to take care of patients over time. One of the frustrations that we know the American patient has is whether you come to Penn or Drexel or anyplace else, or even deal with IBC, sometimes it's a transaction here, a transaction there, and you're a whole person. You want to see if you have a disease, a chronic disease, if you have cancer, you understand how your care is going to be over a period of time, over a year or 2 or 3, 4 years. It's not just one day at Penn Medicine, one day with Blue Cross. How do you make these things weave together? And one of the things that I'm proud of in this partnership that IBC and Penn Medicine have is we're really working together. You saw Elliot put up that iron triangle a few minutes ago. We're trying to work together. Some of these lines are blurring between insurance companies and providers, but we do it as a partnership. We're not going to be an insurer, and they're not going to be a provider, but we're working together to try to figure out how to take care of patients over time. In many ways, I think for all of you, as you get into this field, start thinking more how to take care of populations, how to take care of people over time. That's what the American population wants. And we're all a bit too fragmented. And we think of the kind of fragmentation that goes on in a part of the economy that's 18% of the economy tells you there's a lot of opportunity to be fragmented. So we love the excitement that you bring to this. And I really urge you to keep kind of innovating as you have over the course of the last few years. And we're proud of the fact that many of you innovate inside Penn Medicine. We learn from what you're doing as you're working with us. And it's very enriching to us as well, because it forces us, as we're working with you, to learn from you. I mean, you may think you're learning from us with our doctors, our nurses, and all our staff, but we're learning from the kind of questions you ask, and we're learning from the kind of things, what you think the problems are. Sometimes the kind of jobs that Dan and I have, a lot of things get filtered by the time they ever get to us. So one of the challenges we have always is, do we really know what's going on in the front line? And part of what you're doing is you're coming around, you're asking questions that as you're thinking on behalf of the patient, thinking on behalf of the consumer, you're giving us another additional set of intelligent eyes as to what the issues are. So this kind of innovation is helpful to us in beyond just investing in the companies that we hope to invest in after today. The lens you put on this, the kind of information that you're asking us for, tells us a lot about where we're failing the customer, the patient. And we want to get better and better at this, but we know it's a complex world we live in. So I keep urging you to keep coming at us in a variety of ways, making suggestions as to how we get better, but also realizing the complexity is not going away. So I want to caution you a little bit. One of the reasons companies fail in this space is you underestimate the complexity. So I'm telling you as well, pay attention to that. You may wish there weren't bureaucracies out there, but there are. So you have to figure out how to deal with us, deal with IBC, deal with the government. But the extent to which you have a set of products or a product that kind of helps people weave their way through it and weave their way for the patient over a period of time, you'll be better off and we'll be better off. So I, too, celebrate all you being here today. I'm looking forward to the presentations. And again, I want to thank Elliot for helping to organize this. But most importantly, Dan and Steve Overhigh, our partners from Blue Cross, we work very closely together. We'll continue to work very closely together. I think it's a model. Dan and I say this across the state and across the nation. There's a model for how insurance companies and providers can work together. Because people trust their doctors and nurses. Dan rightfully cites that IBC is more highly regarded than Congress right now. But the people we still hold in the highest regard are nurses and doctors. In fact, I remind our doctors now that nurses are held in much higher regard than they are, so that they don't necessarily like hearing that Mike Garthbrook thing keeps moving off on me here. But the kind of trust that people have in doctors and nurses is something we should keep celebrating, and the kind of products that you have will continue to help us get better at that. So my thanks for all of you being here today. I'm looking forward to what you're doing, and again, I want to thank Dan and Steve and the rest of my partners from IBC for how closely they work together to make this happen. Thank you.
So as many of you have seen before, this is the DreamIt credo, helping extraordinary teams create extraordinary companies. And we live really at the earliest stages of life for these ventures. For many of the teams who come and find us and we accept into the program, it's little more than an idea on a piece of paper. Nothing yet has been built. Very few conversations with customers have been had. And we really find them at the riskiest stages of life, when there's a tremendous amount of market risk, technical risk, team risk, financial risk, operational risk. And our goal is, over a 3 to 4 month period, very short, 15 weeks. These companies have been with us for 15 weeks when you see them today. Drive out as much of that risk as possible and create as much value out there as possible for customers and for society at large. Now today, the companies that you'll be seeing bring to a total 167 companies that DreamIt has worked with very closely since 2008. And those span all sectors of the economy. As I mentioned earlier, 30 of those now are in healthcare specifically. And we recruit for these people all over the country. We tend to find those teams and those individuals often in or around some of the most selective educational institutions the country has to offer, and that has a lot less to do with what's being taught at those places, a lot more to do with them as a filter for some of the most ambitious, driven individuals out there who are finding new opportunities and pursuing those opportunities. And even more important than where they go to school, frankly, is where they have their experiences in the real world, in the workforce, seeing where the white space is, building the relationships, getting inspired to leave and create something new with very limited resources. So we bring them to one location, and here in Philadelphia, that location is our headquarters at 3401 Market, just up the street, the Science Center. And we give them a little bit of money, $50,000 for some starving graduate students. Maybe that seems like a lot. In the context of a company, it's fairly modest what you can do with that. And many applicants look at that as the key thing that they get out of joining a program like DreamIt is the money, but actually it is probably in some respects one of the least important things. Far more important are the relationships that are built, the access that they get, not just to Penn and Blue Cross, to many other partners we have, where they can speak with clinicians, with executives, with subject matter experts. They can test and bulletproof their ideas in the real world. They get access to systems and data and really understand what the opportunity is from the perspective of those in the trenches, their customers. And so that is far and away the most important thing we do in DreamIt Health. But they get a lot of other support too. We assign to each team one or more mentors who are typically startup operators with a great deal of experience themselves building, operating companies, who typically have a lot of domain knowledge as well that's relevant. And these people commit many hours each week to helping the teams in any way, shape, or form. Many of those people are here today. I'd like us all to just thank them for their contributions. Thank you so much. Without your help, this program would not be what it is. The companies also benefit from the best counsel really anywhere in the world. The leading firms in town have generously donated countless hours to adopting these teams and working on every facet of their business with them, giving them counsel, creating documents, steering them through their first transactions with customers and partners. And it's really, again, a tremendous resource. So I would also like to pause and thank these 4 firms for everything they've done for our teams. A big part of the program as well are the voluntary contributions of leading practitioners of craft, whether it's business, technology, design, healthcare, who come in most days of the week and share their wisdom and their experience and best tools, techniques, practices with the teams, giving them skills that really are hard-fought, hard-won by these individuals. And it's a tremendous opportunity to drink from the fire hose, if you will. In addition to which, the DreamIt partners meet with these teams almost on a weekly basis initially and then bi-weekly when we get about halfway through the program. And we're there to keep them honest, not just to help and connect them, but also to create a little more structure and have deliverables and simulate what board meetings are going to look like when there is a board of directors.